Welcome, everyone. Thank you for joining us for today's webinar, The Impact of COVID-19 on DNP Projects. My name is Adrienne Brigitto, and I'm an Executive Director of Nursing at Springer Publishing Company. For those of you who are not familiar with Springer Publishing, we are an award-winning publisher of nursing and healthcare content featuring books, journals, and digital products. Today's webinar will be presented by Molly Bradshaw and Tracy Vitale, authors of the DNP Project Workbook, a step-by-step process for success, and hosts of the DNP Project podcast. Molly Bradshaw is an associate professor and the DNP program coordinator at Eastern Kentucky University in Richmond, Kentucky. She is an experienced primary care nurse practitioner and nurse educator with more than 22 years experience. Dr. Bradshaw has held diverse clinical positions, including staff nurse, school nurse, nurse manager, and active service in the United States Navy Nurse Corps. Her academic scholarship is rooted in chronic disease management, teaching innovation, and all elements of the DNP project. Dr. Bradshaw currently serves as Secretary of the AACN Steering Committee for the Practice Leadership Network. Tracy Vitale is Assistant Professor and Specialty Director for DNP Projects and DNP Project Courses at Rutgers University in Newark, New Jersey. Dr. Vitale has more than 20 years experience as an obstetric RN, specializing in maternal fetal medicine research and outpatient high-risk obstetric care. Dr. Vitale sits on the Board of Directors for the Organization of Nurse Leaders of New Jersey and serves on the Advisory Council for the New Jersey Collaborating Center for Nursing, which focuses on nursing workforce issues. Before we get started, I'd like to mention that this webinar will be recorded. If you miss any portion of the presentation, you can find the video on Springer Publishing's website 5 to 7 days after the event. If you have any questions, please type them into the question box in your Zoom control panel, and we'll address them at the end of the presentation. There will be a brief survey after the webinar. Feel free to include any additional questions in the survey, and we will get back to you with a response. Thank you again for joining us today, and I'll now turn the presentation over to Dr. Bradshaw.
Thank you so much, Adrienne. It's our pleasure to be here with everyone. Tracy and I are both very excited to share with you some of the experiences that we've been having about how COVID has impacted the DNP projects that we're involved in. And our goal is to help students and faculty navigate together some of these challenges. So fundamentally, the DNP project is an academic product, and it demonstrates application of skills that are obtained in a DNP program and mastery of the DNP essentials. We assert that the DNP project is a living process because the degree is a practice-based terminal degree in nursing. Practice is dynamic, and we're seeing evidence of that in the context of COVID. And as practice adapts, we have to adapt. We're always saying to ourselves anyway that practice is messy. It does not occur in a test tube or a lab. Nurse practitioners, nurses, nurse leaders, CRNAs, midwives, we're all out there frontline in the trenches trying to figure these things out, and COVID has certainly had a big impact on that. I believe that the idea of the DNP project is to teach students a problem-solving process. Sometimes I say it's nursing process on steroids, but really at the end of the day, we're trying to take that evidence and come up with solutions to clinical problems, implement our solutions, evaluate, and then share what we know. So our objectives today in this webinar is to kind of support the work that goes into the DNP projects by offering some immediate strategies to stabilize DNP projects that have been impacted by COVID. So we hope that by the end of this presentation, the participants are going to be able to discuss the impact on projects that are in progress, the impact and the complications, the implications of projects that are being planned in the future. And we want to help you solve your problems by integrating relevant strategies into DNP project planning and management. And one of the tools that we offer to help with that problem is the DNP project workbook, a step-by-step process for success. And we'll talk about that a little bit later in the presentation. But we have all had to take some pretty immediate actions, I'm sure, regarding DNP projects. How do we stabilize them? What do we do? We have all, I'm sure, had to adjust some of our expectations. That's sort of inevitable in the context of the magnitude of this situation. we are probably going to have to adjust expectations for upcoming academic years. And I want to be very clear that we're not saying we should make the project easier. We're not saying that we should lower our standards or reduce the rigor of the projects. We're just saying that the way we've always done it is not the way it's going to go in the future. So there's going to be some give and take in that, and we have to learn to roll and to be open to new ideas of that. For current DNP projects, data collection, dissemination, and other milestones are going to need some modification. And certainly projects that are in the planning phase may need a significant redirection and overhaul with help of alternative topics, maybe project relocation, and even concepts of what's being called Project COVID compliance. And we're going to talk to you a little bit about that. So the way we broke this presentation down, I'm going to talk to you about some strategies for projects that are in progress. And then my colleague, Dr. Vitale, she's going to talk to you about some strategies for projects that are being planned in future. When we think about and talk about projects that are in progress, as we have this discussion, I want to make a few assumptions. So these are projects, I'm talking about projects that are probably approved by the DNP team, they're probably approved by the IRB, and maybe the project was in the implementation phase in March, time frame when all this started to hit the fan. So for those projects, I've been calling those students that I'm working with in that situation my immediate impactors, the ones that felt it almost the second we started with some of our issues with this. I think in nursing, I'm sure that I don't have to say very much that safety is always going to be a first priority in everything that we do. So as COVID started to take grip on the United States, certainly we had to make some considerations as faculty and even as healthcare organizations that was hosting students, maybe in clinical sites and things like that. Safety always has to be the first priority of the student, but it also has to be the first priority of the populations that we serve, and stakeholders are obligated to protect their patients, their constituents, their clients from that. So when this all started to happen for those students that were in the middle of their project, I had to personally consider just an immediate end to data collection. Some of my students who were in perhaps the 4th week out of 6 that were collecting data, they were asked to leave their clinical site. We're like, no more. You're going to have to just report on what you've got. In other project situations, we were able to remotely access some of the data to go through some of that. So it was okay to do that. But there was definitely an immediate, what are we going to do? Are they going to be able to finish an implementation, finish a data collection? But the decision making on that at first had a lot to do with safety. And when we think about projects that have gone off track, COVID is not the first time that we have experienced DNP projects that have fallen apart. So faculty with me, raise your hand if you have been with a student and their DNP project just totally fell apart. Often not for anything that the student did wrong. I've had students that were going to do a project and they shut the whole unit down at the hospital. There are personal tragedies that go on. We've been through hurricanes. There's lots of reasons we've all experienced projects that have gone off track. But what's unique about this is it may be the first time, I know it is the first time for me, it's the first time I've had so many projects fall apart at the same time. And that's what's making this a little bit of an unusual situation. But as a faculty member, I think the first thing we want to think about is there precedent? So what did we do in the past when projects fell apart? Did we make the student start all over again? Did we modify the project? How was that handled? So that's a good place for faculty to take some assessment, is what has been done in the past and what's happened in the past. And that might help you set some precedent for how things are going to be handled at your school. There is likely going to need to be some process issues that need revision. I'll give you an example for myself. We require that students turn in both a printed bound copy of their paper and then also to upload one into our university repository. But because of all the restrictions, I couldn't ask students to go into Staples and get that done. So we had to revise that process on the quick to make sure that we were meeting that. And as faculty, we always want to be thinking about, what do you have to have versus what's good to have? So think about the documentation and the items that you need for accreditation or for your university requirements versus what's just good to have, and what's, it may be nice to have it, but it's not absolutely necessary. So for a lot of DNP program leaders, there's some command decisions to be made. I mean, I had to just make some decisions. And as I always like to involve my faculty in some decisions that we're making, a lot of this had to be decided pretty quick. In response to that, if you're having to make quick decisions, it's wise, I believe, to create an emergency supplement to your DNP guidelines or your DNP handbook. Because if you change your expectations, if you change what you're going to do, you have to give clear instructions. You have to give clear instructions to the faculty, you have to give clear instructions to the students, and you have to give clear instructions to all the stakeholders that might be involved in the projects on the outside. If you're changing evaluation or the process of that, make sure you keep documentation for your accreditors. And our goal always is to minimize and avoid frustration to our students, and clear instructions do that. The benefit of creating a supplement like this is you can use it in future emergencies. I would like to say that I hope that none of this is going to happen again, but we're hearing all kinds of things, maybe fact, maybe fiction, about, is there going to be a resurgence? Are we all going to go to the beach and spread this more? Is there going to be another virus that comes through? I mean, who knows? But there will always be emergencies in the future. But having that emergency supplement might save you some trouble in the future. But this whole situation has really caused all of us to take a hard look at our process and determine what our needs are. For these students that have, again, projects in progress, we all need to sort of recognize that perhaps resources have been impacted, particularly resources for data analysis and writing support. As our universities have closed campuses, also resources that are available to our students have been closed. As faculty, I believe that we have to step up in response to that, offer more examples, more videos, more guidance. We have to be sensitive, I believe, to the limitation of student finances during COVID. Many people have lost jobs, their spouses have lost jobs. I even myself, I'm a nurse practitioner, and my clinic furloughed me in all of this, and I would have never thought that would have happened to me. So there's always limitations to be sensitive about with that. So it's not as easy to say to a student, or even if you're a student, I know it's not easy to just say, well, I'm going to go hire a statistician to do my data, or I'm going to go hire an editor to look at my paper. It's not as easy as that. So we all just have to be patient with one another and just kind of recognize that support has been impacted, and try to think outside of the box on that. Also, another thing to think about is that the COVID pandemic might create opportunity for us. If the project has been in progress and been cut short, one of the things you might consider doing is ask students to expand on the limitations in their final write-up. So let's say, hypothetically, I'm talking about the student, I cut her data collection off. At 4 weeks, she was planning to do 6. What I did in return is I had her write a larger section of limitation than what might be typical. Usually when you're writing up your DNP project final reports, you might have a paragraph or 2 on limitations of the project. I really had her go into some detail about COVID and how it impacted that, so that there's another layer of analysis that she's going through. It's organizational assessment. It's all these DNP skills that she can still try out and that she could still use. Another thing I've done with another student is, when the project got cut off because of COVID, we supplemented the data that we were not able to collect by adding a needs assessment. So this particular student was working with heart failure patients in discharge planning. The planning with the nurses was implemented, but we didn't get to the data collection part. So what we did was, to give the student experience of working with data, we took what we had from the in-service, and then we supplemented it with another short survey, 10 questions, nothing crazy, that we created asking the nurses, how has discharge planning changed with heart failure patients as a result of COVID-19? And just getting that feedback. And again, that was the supplement to that project that we were able to utilize. Just some examples and some things to think about. You might ask a student to look at some of the COVID public health data or the organizational data on COVID as that expansion of limitations, that mini organizational assessment. There's still things students can do on the quick to contribute back to those partnering organizations in the context of COVID. But asking them to complete that supplemental work might help offset the void of some of those projects. Also, with in progress, we've got a plan perhaps for alternate ways to present the final findings in academic settings. If you are not a school that's online, if you're going to an in-person school, I know at Tracy's school, they have a big day. It's like a conference because there's a lot of students, you know, there's posters everywhere and everybody's mingling and talking about, it's kind of a day of celebration. And then there's breakout rooms and everybody doing final presentations. That can't happen. So how are you going to handle that? And how are you going to do it on Zoom or WebEx? And so thinking through some of those alternative ways. We believe, Tracy and I, that a DNP project dissemination should have 3 elements: a paper, poster, presentation, because we want students to have a skill set to share information in multiple ways and to multiple audiences. We might have to think about utilizing centralized drop boxes to collect some of these items, to collect the DNP experience, the clinical logs, final copies of our DNP products. I mentioned that before. If you're not using a project repository, now would be a good time to investigate that. We have good friends at DNP Incorporated that have a repository. There's the Virginia Henderson Library. Your school has different repositories, but it may be a good time to take a look at a repository if you're not using one. And in our workbook, talking about alternatives for dissemination, that's some of the topics that we cover in Chapter 8, is just some of these different strategies. So I'm going to turn this over now to my colleague, Tracy, who's going to talk to us about projects that are being planned for the future. Tracy?
Thank you very much, Molly, and thank you everybody for joining today. So for me, this was a huge challenge as we began our spring semester. As Adrian had introduced, I'm at Rutgers University in Newark, New Jersey, and just can literally see New York City and the epicenter of where COVID-19 really started to wreak havoc on our country. And while all that was going on, just to give you some context, we had 160 students enrolled in project planning. So certainly an opportunity for us to have a lot of work cut out for us in helping students readjust some considerations related to their project. So that being said, a couple of components that you want to be aware of when thinking about projects that are being planned is you need to determine the status of the partnering organizations and understand whether or not students are even going to be allowed to be in the organization conducting the project. In addition to that, it's important to consider what the current needs of the organization are. Are they still allowing projects to continue? Are the topics of the projects that were identified still a priority for the organizations? Because that's really going to drive whether or not the project can move forward. It's also important to consider go back one slide, please. To evaluate the feasibility of the project. So meeting with the students to determine can the project be planned, can it stay intact, or if modifications are going to be necessary. It's also important to consider the approving body's requirements. If the approving bodies are changing their processes or protocols required for DNP projects, as well as ensuring that any protocol that is put forward is in fact what I have coined as COVID compliant, meaning are they complying with social or physical distancing requirements, and what potential impact having a protocol be COVID compliant will have on recruitment implementation, the ability to collect data, etc. So on the next slide here, I have examples of projects that were being planned in, over the past several months, and in mid-March required to some extent some type of modification in their writing. The first has to do with site concerns, and this project resulted in a complete overhaul of the project. This project originally was intended for the student to implement a cultural awareness program for emergency room providers. This project site was in the middle of New York City, and clearly with everything that was going on, it was not a priority. It was not the time or place to be, and the feasibility was just not going to happen. The student had communicated with the nursing leadership and determined not at this time. So the student was really concerned about being back to the drawing board with where to go with her project. So in collaboration with me as her faculty member, as well as her project chair, we tried to keep her project as intact as possible in terms of the work she had done in terms of background and significance and identifying the need for cultural awareness among providers. So she adjusted her project to be focused on the development of a clinical practice guideline for healthcare providers. In this case, it's not site specific. It's something that can translate to providers regardless of where they're working. And while it did require a whole lot of effort on her part to reorganize it, she was grateful that she was able to only have to provide a much smaller amount of modification to the proposal than she had originally thought when she realized everything was going to get turned upside down. The second example that's listed here included a change in approach to the methodology. It required a revision to the project site. So this student was planning on implementing a mindfulness app to improve stress levels among nursing students. And we were waiting for one additional document in order to be able to hit submit on our IRB application, when it was identified that there were some concerns about providing an additional level of stress on already stressed nursing students, meaning the stress of having to be asked to participate in this project, even though it was voluntary. These students that were the intended population, intended participants, were being faced with canceled clinical rotations, what was going to happen in the summertime, and the general concern was this might not be the right time to ask these students to participate. So what the students were able to do is they were able to identify a different school that had some different circumstances, not quite the same as the original school, and they are more than willing to participate. In fact, have offered, and we are moving forward with it, to include not only undergraduate nursing students, but also include graduate nursing students as well. So this change in methodology, while really it was only a change in project site, did result in the students needing to now add a second layer of IRB approvals because they need the new school's approval. But it's also, again, as Molly said, it's an opportunity for us because these students are now going to be able to have some additional levels of data analysis in terms of doing some comparison between undergraduates and graduate students. And the last exemplar that I'd like to speak about that most of our projects were able to adapt to was the change in project approach. So specific to COVID. So this particular student was looking at maternal infant feeding attitudes and exclusive breastfeeding rates based on some counseling and support training. And her original intention was to provide in-person training, in-person support, and obviously based on the requirements of social distancing and concerns over additional personnel being in the hospital, the request was made and subsequently approved that this student transitioned her training to be web-based, still allow for some interaction, but allowed for us to maintain the separation and prevention of that student from having to be on site during the pandemic, unless absolutely critically necessary. So next slide. The first step is, again, to reassess the needs of the partnering organization. It is possible that we may need to reevaluate the feasibility of the project, and maybe there's an opportunity for students to conduct needs assessments and identifying new and different opportunities for the facility. It's also possible that these projects may not require IRB approval depending on the program's, each individual program's requirements. Students are encouraged to identify if there are new needs that can be addressed. Maybe the project site is still allowing the student to continue conducting their project, but they want them to focus on something else. The student should be aware of any adjusted timeframes that the restructuring or reorganization of planning the project might require, and as well as consider the possibility of any remote work. So like in my last exemplar, the student was able to conduct most of the work remotely without having to be on the project site. And then when she's doing her data analysis, there's some collaboration with the site to allow for remote access to the electronic medical records, as well as the data collection from the staff nurses in terms of their feedback and perceptions of that breastfeeding work. I think that it's important to consider here, and we will talk about it in a little bit, that when we look at the AACN's clarifying recommendations in what the DNP project requirements are, we have an opportunity to be creative. It outlines that there needs to be data collection. It outlines that there needs to be data to be analyzed, but it doesn't say in what order it needs to happen in, or what exactly needs to be done. So, I'm going to talk a little bit about what opportunities we have to consider non-traditional projects based on what may or may not already be happening at your institutions. And I think an important step, a critical step for our faculty, is to meet with the students and be frank about the realities. As a nursing leader, I always am a firm believer in we have to be comfortable having uncomfortable conversations. And boy, did that come out loud and clear this semester with these students in the work. We encourage them to be working as early as possible on their projects and thinking about ideas. And when that gets pulled out from under them, those conversations can be really tough. But what I have found is that students have been very appreciative of the upfront nature of the conversation and laying it all out there and saying, here's where we're at, here's what we can control, here's what we can't, where do we go from here, and being that support system for them, rather than just saying, well, good luck with that, figure it out. Really helping them navigate through that process and recognizing what can we save, what can we keep and move forward and build upon. And yes, and it's adjustment, but let's also consider how this can possibly end up an even better project than what you had originally planned. And then from there, consider the new trajectory of the project. Next slide, please. So that being said, once any adjustments to the project and the conversations with the students happen, it's also important to be aware of any changes to the process or protocol expectations that are beyond the student's control. So what I mean by that is we need to consider any potential impact of the site research councils or approving bodies from the project site perspective. It's important for the students to be aware, are those research councils still in fact meeting? If they are, they're likely meeting remotely, and is the student going to have to be logged into those meetings to participate? Are they delaying the meetings if if the research council is saying we're holding off all research, we're not doing any non-COVID specific projects until the fall, then students need to be aware of that. So it's important for them to have that contact with the project site to understand any potential impact. It's also important to understand the institution's IRB process and any modifications that might be necessary based on institutional guidelines. For example, some schools may be expediting reviews or prioritizing reviews of COVID-specific protocols, and all other work is being held until a later date. So again, something individual based on the school's expectations that folks will want to be aware of. Universities are also expecting that the protocols that are submitted do include verbiage specifying how the student and co-investigators are adhering to COVID compliance. So for example, students are expected to include how they are recruiting in light of COVID social distancing requirements, how are they modifying their interventions, example of the web-based training instead of being in person. They have been asked to specifically mention how the protocol has been adjusted to meet those expectations. And again, be aware of the frequency of the meetings of these groups. Most IRBs of folks that I've been involved in outside of my own university is they have said IRBs are continuing to meet. There's no expected disruption in how quickly reviews are happening, et cetera. But again, you want to be mindful of that and communicate that back and make those considerations when considering the timelines that are necessary for the projects. Next slide, please. Another consideration that's important when we're thinking about projects being planned is how it may impact the DNP team members. So most projects have a project mentor or project chair that's likely a faculty member, and the team member may be someone from the project site who has some stakeholder buy-in. They may be the content expert. It's important to consider how those roles or members in those roles may need to be adjusted in consideration of any changes that are made to the actual project or protocol. Are the original team members still the most appropriate to be including in the project? You want to consider if faculty workloads are different in terms of shifting responsibilities and how is that accounted for. Molly and I have been in numerous conversations on the national level in terms of whether or not faculty receive workload for projects and how is the workload accounted for. So again, it might be very individual based on the institution, but you want to consider that as well. And again, speaking to our team members, if they are a member of our community partners or involved in the project, is their access limited? Are they available to continue to commit to the requirements of the DNP project? So for example, if a project is going to take place in a public school with the nurses or even with the teachers, have their responsibilities within their individual school districts been reallocated or with additional responsibilities to accommodate adjustments because of COVID? Are those folks still available to participate and have meaningful contribution to the DNP project? Next slide, please. So when we talk about the complete overhaul of projects and new opportunities, I think that that's really important to stress. As Molly said earlier, practice is messy in reality, and this is certainly a perfect example of it. DNP projects are living experience. I think although the students might not want to hear it, adversity builds character, and this is certainly an opportunity for them to do that. I think it's a great opportunity for students to really grow and excel in the leadership role. They are really going to have to step it up and be that in-between person in understanding what the projects are going to be allowed to facilitate, meeting the needs of the project requirements for the school, and really guiding how the project will be moving forward. It's an opportunity to consider new or non-traditional projects from what your school may already be familiar with. So examples of new opportunities might be conducting a program evaluation. So something that has already happened. Again, like I said, the AAC recommendations do not tell us what order the clarifying recommendations need to happen in. So maybe the project is an evaluation of a program that has already happened. They're able to analyze that data, and from there, they're able to develop a business plan or recommendations or a policy change based on those programs that have already happened, and the student is no longer trying to institute something new amid a crisis that hospitals are facing. There's the consideration of developing policy briefs or advocacy projects, and really involving our DNP students with local and state legislators and moving policy forward in considering how nurses are impacted or can impact health policy. Another opportunity that students might be able to consider is conducting a systematic review paired with measuring impact of findings. So again, we know that systematic reviews alone do not change practice and are not considered an appropriate DNP project. But if there is a knowledge transfer piece that can be included in that, and there are facilities, universities that have a well-established program to support conducting systematic reviews, students should be encouraged to do that and think about how the results of that systematic review may be able to impact practice moving forward. There's an opportunity to develop and implement health literacy resources. I think especially with COVID being new, there's an opportunity what resources are out there for students to consider specific to that topic, or any topic that might be important to a student in the role that they plan to transition into once they graduate. So lots of opportunities. So what we have done, I'm going to briefly introduce our workbook here, is to consider the active learning. The focus of our workbook is to promote active learning and engage students in short lessons that are going to help students complete the process. The project is a marathon, it's not a sprint. And I find that students often find satisfaction in those brief, short success stories. So in considering how the workbook ties into what's going on with COVID, if students need to readjust their plans, using the workbook and these worksheets to quickly reevaluate and refocus their ideas may really be beneficial. There are worksheets that can be submitted to the faculty. We offer assistance with some common issues and advice to troubleshoot the project. The workbook can be utilized throughout the entire DNP program from start to finish. We also direct students to other resources and when to involve faculty in that decision making. Of course, we remind students to check their school requirements because each school is going to have some specific nuances that they require. We're really proud to have some expert commentary and student commentary as well in the workbook, and lessons are mapped out to align with the DNP essentials. And it is a workbook. We want you to use it. It's not meant to be a textbook. It's meant to be hands-on, rip out the pages, etc. On the next slide, we've got some quick little images here so you can see it's really meant to be active learning on behalf of the students. And like I said, if the students need to regroup, it's a great opportunity to keep them on track and refocus some of those ideas. So I'm going to pass it back off to Molly, who's going to talk about some quick suggested lessons that might be specific to the students as they consider adjusting to the COVID-19 concerns and their projects.
Thanks, Tracy. This is really kind of just to demonstrate to both students and faculty, again, how this tool might be helpful to you. The way our lessons are laid out, you know, lessons chapter 1 through 10 and this type of thing, but they're labeled in a way you can kind of say, okay, I need to go check what the DNP project requirements are at my school. Oh, in the table of contents, that's lesson 1.8. Or I need to complete a student reflection. Okay, that's lesson 9.13. So there's ways that you can combine the lessons or go back to the lessons in a way that's meaningful depending on the context of what's going on. I know for myself as a faculty member, this has already been very, very helpful to me because I've been able to say to the students I've got in summer courses, okay, get the workbook, let's talk about this. And they're able to do some work ahead of time and then bring it back to me as a faculty member. And it's so much more meaningful because it's given the student a chance to think through some of the common questions that I'm going to ask them so that when we get together to discuss, it's a better use of their time, it's a better use of my time. But specific to COVID, so let's say you've got a student that's a challenge, or students, if you're out there and there's some different things going on with your project. As an example, you might have to go back and check those school requirements. As we said earlier, you might have to recreate your DNP team. There's a lesson on that. Cognitive walkthrough is an exercise actually that we borrowed from technology, from the technology industry. And it really has to do with imagining yourself walking through steps of a process, or imagining yourself walking through an environment. So if a student's planning a project and they can't physically go to the clinic, maybe they imagine that they're a patient, they're coming into the waiting room. Then they do a check-in, then they get triaged by the nurse, then they go back to an exam room, then they check out. It's kind of mapping out the steps that would happen during an office visit so that you might identify problems. There's lessons on helping us all keep mindful of DNP project quality and rigor, how to find evidence and data, using our emotional intelligence, which I think is really important right now. We talked earlier about lessons that would help maybe if you want to disseminate on some social media or do some kind of alternative disseminations. We've done a lot of work to make sure that these lessons are mapped to the DNP essentials. So in the faculty resource, it's all mapped out. This lesson matches up to these DNP essentials. It's all mapped so that the faculty don't have to work on that. And we've even given some advice on the approach to negative or bad results. Like, what happens if your project, the results aren't good? What do you do about that? And how do you handle that? How do you speak to that? So that's just a little bit about how the workbook might help you a little bit. So just to summarize and kind of bring it home a little bit, the future of DNP projects. We've said earlier, consider those collaborations, community partners for pipeline projects. Maybe one group of students starts it, the next group continues it. Think about those non-traditional projects, but we want to look perhaps to other industries on how we make impacts on organizational change, teamwork, systems thinking, and process. There's lots of great ideas that I think nursing can take note of from other industries. And do these projects, does it meet a need? Is it helping our students apply skills? Is it helping ensure that they master these DNP essential skills and meet their competency? Because at the end of the day, the DNP project is really a learning experience. And we all need to remember this is a learning experience. So the COVID, it's going to have an impact on projects now and in the future. We're going to take these immediate actions, partner with our organizations and stakeholders, so that we can improve our programs and make sure that we stabilize our learning environments. Remember, everyone, that flexibility is granted to us to a certain extent. Now, personally, I don't want to see us as a profession take backward steps. I very strongly believe that a project is find a problem, know everything you can about the problem, go to the literature, talk to stakeholders, come up with an evidence-based solution, but you've got to implement something, evaluate something, and share with others what you know. As Tracy said, it doesn't have to happen in that order, but it still has to happen. So we don't want to regress back to the old days when we were just doing things where we make a recommendation and stop. We still want to make sure these elements are in there. So I'm really passionate about making sure that we don't take backward steps. But this is a remarkable situation. I think we have to keep an open mind about the growth and perspective and different things that's going to happen. It's going to change. And so we need to live with that and embrace that and actually count on that. Like we've all heard, change is the only thing that we can count on. So we hope that was helpful. If you'd like to keep following us, Tracy and I have just released a new podcast called the DNP Project Podcast, Tips, Inspiration, and More. And it's available now on Spotify, YouTube. We've got a website. It's on all the other, actually, since I've made this slide, it is now on Apple Podcasts, Google Play, Stitcher, all of these other outlets. So we hope that you'll follow us. There's 6 podcasts that are out there right now. We're going to be releasing bundles of these periodically. And if you'd like to give us an idea about maybe a topic that we need to cover or something that you'd like to hear more about, we would love to have you email us at dnpsuccess@gmail and give us those ideas or those topics that you want covered, so that we can serve you and continue to serve you through these. I mean, we're all kind of in this together, so I think we all have to put our heads together to figure all this stuff out. So that concludes our presentation, and now we would just like to open it up, return it over to Adrian, and ask and see what questions you might have.
Thank you so much, Molly and Tracy, for the webinar. It was incredibly informative and very interesting, so thank you very much. We do have some questions from the audience. Our first is from Diana, who's asking or noting that one of her students is changing her project, which involved developing a camp for children with sickle cell disease. We are moving to a process project with the development of the content of the educational interventions for children and parents. What are good outcome measures for process projects?
So off the bat, I'm going to say, and this is off the top of my head, satisfaction is always one. And when you're setting up outcomes like that, it depends on what the objectives of the teaching was, right? So anything that we teach or develop or in service or anything like that, we should always set out a lesson plan in the beginning. So there should be something in the beginning that says the purpose of, this educational program is to do X, Y, and Z. So some of the outcomes come directly from that. So I think the answer comes from, what is the intent? What are you trying to achieve? I would always encourage people to avoid knowledge, because knowledge alone does not make people change their behavior. So to get people to utilize their knowledge, there's models out there like knowledge to action. There's some great language from the IOM that we have that say, if you couple knowledge with other things, like a reminder system, some kind of tool they could use. If this is a camp for sickle cell families, maybe a checklist of when to go to the ER and when not to, those types of things. So you want to have them utilize something. So I would try to look at maybe satisfaction, compliance, those type things, but it really depends on what the purpose of that camp or that teaching was in the beginning. Does that make sense?
Yes, thank you. So we have a lot of questions. Another one is, at Rutgers, do you have teams of students designing projects, as it sounded like a group of students were doing the project?
Hi, thank you for your question. So we, at Rutgers, we do allow group projects, no more than 2 students. However, personally, I discourage them. Only because for a multitude of reasons as well, including life happens, and what happens if one student has a life event and can no longer move forward, and where does that leave the other student? Someone's going to be, out of luck and have to come up with a new idea. But as well as, again, personal feeling, no other terminal degree allows group work for their final cumulative project. But to answer your question, we do allow group projects. And let me just, in terms of managing them, we require students, we have a team form that we use where each student is required to list how they are going to be able to reflect that they were able to complete all of the requirements of the DNP project. So each student is responsible for writing the paper. It ends up getting synthesized with the partner into one final paper. Each of them must display proficiency in data collection, in conducting data analysis, and presenting it. So we do have a tracking form that we use to help ensure that each student can be individually evaluated.
And there's a worksheet on that in our workbook as well. And I would also encourage to check the AACN language on that in the clarifying recommendations white paper, the 2015 paper. There's some pretty specific language on group projects.
Great, thank you. Question from Susan. How did you address the practicum hours needed for your DNP program completion when students were not able to implement fully or have an alternative project?
So the first thing that I would say is it depends on if your program is perhaps a BSN to DNP program or a postmaster's DNP program. So the language from AACN does not stipulate that the practicum, or we call them experience hours rather than clinical hours, whatever your school calls them. If the hours are being spent to learn an advanced practice role, so for example, if you're spending those hours to learn to be a nurse practitioner or learn to be a CRNA, in my mind, that's a different thing. It's a different set. It all contributes to this 1,000 hours post BSN, but specifically talking about the DNP project, there is no rule about what counts or what doesn't count. Now, frequently what we hear is students want to count things like their writing and their reading hours and things like that. Personally, I do not allow that in my program. I call that doing your homework. This is a doctorate, so, but I do allow students to do things like completing IHI training on the quality improvement process. I do allow them some time for writing their final DNP project report, creating some of those projects. We just have some guidelines at our school about how much, and there's some limits in place. So that's a decision that your school has to make. Every school gets to interpret that differently. But again, those are for project hours. That is not speaking to hours that are, for example, required to take an F&P certification exam or a certificate. We're not talking about those hours.
And to confirm, someone else asked, has AACN made any adjustment in the project or hours requirements?
No.
Okay.
And I actually checked on that the other day, so I did not see anything posted. And honestly, I don't anticipate that they should need to. Now, I do not represent the AACN. I'll be very clear about that. This is just the Molly Bradshaw total opinion. But I have not had problems yet with them completing their hours because they can still get on Zoom calls. They can engage in discussions. They can still do things to meet those DNP essentials. That's not just spending direct time with it can be adjusted. So.
Great. Another question. Tracy mentioned a project related to nursing education and nursing students. Is that acceptable for DNP projects since CCNE does not recognize nursing education as an advanced nursing practice specialty?
Yes, so thank you for your question. I wholeheartedly agree with what you're saying, and yes, that's correct. CCNE does not recognize nursing education and I do not promote nursing or education projects. Like Molly had said, education alone is not going to change practice. So the focus of the project that I spoke about was the population was nursing students, but the project was not about education. It was about use of mindfulness and whether or not it was helpful in reducing students' stress levels. So I wholeheartedly agree with you, and I think that that's a point to be reinforced, that we are not educating nurse educators, and that student projects should consider that when being approved by faculty members. I always support students. We often, and again, this is one of the questions that we ask in the workbook that we want students to think about, is think about what program you're enrolled in. If these students are looking to become pediatric nurse practitioners in the future, I always try and advise students to think about a project that's going to impact them in that role as a pediatric nurse practitioner provider. Because yes, this project is designed to be a learning experience for the students, but we want it to be a foundation for future scholarships. So if you're doing a project on bedside report, but your practice when you graduate as a DNP is to become a pediatric nurse practitioner out in the community, great, you have a skill set, but you've invested a whole lot of time into a project on a topic that is likely not something that's going to impact you moving forward.
Great, thank you very much, Molly and Tracy. This was fantastic. A couple notes for the attendees. On the next slide, we have a discount for you for the DNP project workbook if you're interested. And also, Tracy included the link to the podcast in the chat box. So if you'd like to directly link to their podcast, someone asked through chat, is it appropriate for students as well? And Tracy said, absolutely. So we've come to the end of our time. Thank you again for attending today. It was truly a pleasure, and I wish you all the best with your DNP projects and your students.